First off, thanks so much to Digital Health Canada for the recognition. I think what this means to me at this stage, I mean, there's nothing more meaningful, I think, than an award that comes and is voted on by your peers. And so it's, incredibly validating of the approach that I've been taking over the last several years with respect to how we're trying to integrate artificial intelligence into routine care delivery and healthcare system, but to do it in a way that's really responsible, careful, ensuring that equity is at the heart of everything we're doing. And really measuring clinical impact with a high degree of rigor to make sure that we're making the right kinds of investments. And so it's very validating of that approach that we're, I'm on the right path and really need to double down. So, yeah. I think one of the things that's really changed for me over time is really, even though I'm working heavily in technology, I spend less and less time really thinking about technological leadership. And more I'm thinking about the clinical and organizational dimensions of technology projects. And I think this has been more true of AI than almost any other form of technology I've done. We've really started to realize that, the AI piece, it's important, and I don't want to downplay the importance of AI models, but to actually achieve clinical impact takes integrating AI deeply into care pathways. And it's about understanding the root cause of the clinical problems that we hope AI is going to help us solve, and working with clinicians to figure out how AI can actually be seamlessly integrated into the care that they provide. And that's about thinking about things like human factors, thinking about, people management, implementation science, and in a way that it kind of goes beyond just thinking about technology and data. I think right now what's sort of top of mind is having completed recruitment of the first randomized control trial to be conducted on a Canadian-developed AI product. And this is something that we built in Hamilton Health Sciences, trained an algorithm to help us optimize the use of invasive cardiac testing versus non-invasive testing to ensure that patients get the test that's right for them. And this is going to both save the healthcare system a lot of money, but also really improve outcomes for patients, because inappropriate invasive testing can result in really serious, rare, but serious morbidity and mortality. And so, being able to prove without a doubt, right, with the highest quality of evidence that this AI product really can work in a live environment, can improve outcomes, reduce costs for the system, and address existing health inequities, particularly for women who are facing a much higher risk of these iatrogenic effects without a chance of therapeutic benefit compared to men. Showing that this AI product completely eliminated that discrepancy was hugely meaningful for me. What I'm really hoping is that a big focus of my work has really been expanding the conversation around artificial intelligence to get organizations to really think about the kind of value that they should be thinking about when they're planning AI interventions, and really putting the quintuple aim at the heart of the conversation. So to not just talk about how we can improve efficiency, which is how a lot of discussions around AI rotate, but how we can really use it to enhance health outcomes while simultaneously improving provider experience as well as patient experience, and most importantly, health equity. And making sure that you can actually achieve all five of those, right, when you're actually launching an AI or really any digital innovation. And I think that's something that has been really important in distinguishing my work, and something I have really focused my educational efforts on, really teaching people how to integrate that perspective into their day-to-day work.